So when patients ask me about silicone versus saline, I have to admit I'm very biased. I like silicone much better. I don't really believe that there are significant health concerns to be had, and as far as the appearance is concerned, they're probably, in my opinion, very similar. I don't think that saline implants look any better or any worse than silicone implants. But in terms of which one patients would rather have, it's very hard to tell when someone has a well-done silicone breast implant. Um, they both look good, but the feel is just not there with the saline. Um, a silicone breast implant, many times, you pretty much can't tell the difference between what is breast and what is implant. I'm not really convinced that there's any significant safety concern with the silicone implants. The FDA has now made an advisory that women should have an MRI performed periodically after having silicone implants because it is more difficult to tell when they break. So should a silicone implant rupture, you would rather have that free silicone out of the breast capsule. But other than that, they really don't seem to pose any significant trouble. I don't believe that they are truly associated with any problems with autoimmune disease or any of the other things that they've been suspected of. As far as the placement of the implants is concerned, if I have a woman who is getting closer to a time when she needs to have mammograms, I always recommend that we put the implant behind the muscle. If a patient has a history of breast cancer in the family, I put them behind the muscle. And the reason for this is it is easier to visualize the breast tissue when the implant is sort of out of the way. The advantage to having an implant above the muscle, just under the breast tissue itself, is they are a little bit more voluptuous. It's a little bit more obvious. They certainly aren't nuded at all. Some of those things can be affected by the style of implant that's chosen also. But I personally prefer to have somebody look a little bit more natural than phony.